I was surprised to know how early they really do go into the dentist. Like when I had my first daughter, they were like, she's got to go like right now. And I was like, she has one tooth. Like, what do you mean?
Well, I had a friend of mine had said she was really not really happy, but she was relieved, I guess is a good way to put it, when people wore masks. She's very self-conscious about their teeth. And as people have gotten less mask wearing these days, right? She still wears one.
And they didn't know they had it. And I'm like, we need to fix this. Like, you need to know what's going on in your body, just like you would for like a medical issue. Like you wouldn't have a medical surgery and be like, what did we do? Like, you're going to know all the details, and because you want to know, and it's your health. So I love educating patients.
We're Erika Marie and Marie Lifschultz, a San Antonio area realtor and lender, but most importantly, we're working moms.
The goal of this podcast is to provide support and a sense of community to San Antonio area working moms like us. So join us in trying to find a balance between career, family, and everything in between.
Welcome to this week's episode of the Working Moms of San Antonio podcast. Today we have a guest who is a working mom and also a dentist that owns and runs her own practice. So I'm going to turn it over to her and let her introduce herself.
Hi, I'm Dr. Adepeju Igun, but my friends and outside of the office, I just go by the name Buki, just shortened for my middle name. So yeah, thank you for having me.
Well, thank you for coming. I love your name. It's beautiful.
Thank you. Most people get frightened when they see it. So thank you.
So, Boogie, tell us a little bit about running. Tell us a little bit about the story behind your office. Like I know you recently opened, you had told me, and kind of tell your story about
that. So my husband is a physician here in the Alamo Ranch community, and he opened his office in 2015. And, you know, I was pregnant with my second. Like I had her the week he opened.
Oh, wow.
I was not going to open an office. And so that wasn't on my mind. And then in 2021, we converted half of his office into a dental office. And I opened it in May 2021. So we are a medical dental office.
And what kind of clients do you have? Is it just adults? Do you do pediatric stuff?
So I see all ages. I see pediatrics also. As soon as they get their first tooth, I will see them. My favorite patients are 6 to 12-month-olds because they're so cute and they actually open up for me.
Yeah.
Because they're teething. So yeah, I see as soon as the first tooth comes in. As far as treatment, I would refer to a pediatric dentist if they need a lot of treatment. Pediatric dentistry is tough in terms of behavior. The actual dental work is not hard, but it takes a lot of skill and energy. And I my first job was actually heavily pediatrics, but I was like, ooh, I think I just want to focus on adults. But I love seeing kids for preventive care and educating parents on how to take care of their teeth, educating the kids and how to take care of their teeth. So 10 and up, I usually do treatment. It's like 1 or 2 things. I'm not going to refer them because that's just frustrating probably for the pediatric dentist. But yeah, so I see all ages.
Yeah. I was surprised. I know when I had kids, I was surprised to know how early they really do go into the dentist. Like when I had my first daughter, they were like, she's got to go like right now. And I was like, she has one tooth. Like, what do you mean?
Yeah. And you know, a lot of people get confused by that because they're like, well, they don't even do anything. They just brush their teeth. And I'm like, okay, so the appointment is really for the parents.
Right.
Because we're trying to tell you like, so this is what you should do. And this is what you should expect. And this is what is going to happen. And it's also to get kids, you know, comfortable in the dental office so that by age, 3, 4, or 5, they'll actually let us take x-rays on them. They're used to the environment and what we're doing, you know, the suction tip, we call Mr. Thirsty, all this stuff so that it's not like they come in at 5 and they're like, well, what are you doing? What is that? And freaking out.
Oh, that's true. Yeah. And I never thought about it that way. Like making sure they get comfortable and it's not something strange to them.
Right, exactly. So they're used to the environment and, it's kind of a little bit more smooth sailing for most kids. Some kids just will always be anxious and, that's okay. But yeah, that's kind of why we want to see them early on, both for the parents and the
Yeah.
kids.
Well, I agree, Erica. I don't think I knew becoming a new mom 15 years ago that they would see them so early. I had no idea. And so
Yeah.
I think it was my pediatrician said, hey, you should start taking them or you should get a, pediatric dentist or something
Yeah.
to start having their teeth, cleaned and so forth.
Yeah.
So, no, it's awesome.
I've seen as young as 2-year-olds that have like a lot of decay. That's usually in lower socioeconomic status, but and it's kind of sad. It's just because no one told them or they didn't know what to do. I've had moms that are like, I just wipe their teeth with water. And I'm like, no, you can use toothpaste. Like, just, you can do this. It's fine.
Yeah.
But you just don't know. So that's why it's good for the parent as much as the kid to come in early.
Well, knowing how you can help them and teach them, brushing their teeth in the right way to do it. Because a lot of times I always have trouble getting to the back of the tooth.
I have my youngest is 2, and I think she has a little bit of a gag reflex, like none of my other kids did, and I'm like, what is happening? So like whenever I go to the back on her, it's kind of tough. And 2-year-olds, they don't want to stay still. It's like wrestling an alligator, and I'm just like, I'm not hurting you. Just let me brush your teeth. So.
Yeah.
I just tell parents as soon as if they're upset and they're that is perfect. Just go straight to the back teeth and just brush while they're yelling at you. And then you can work up to the front. So just, try and go back there as fast as you can. It doesn't have to be the full 2 minutes we recommend, to adults. Obviously, we're just trying to get something on their teeth at that age.
Yeah.
So yeah, there's
My youngest did the same thing. He he still does. He's 13 now. But he has always had a gag reflex. Like I was embarrassed actually taking him because my oldest one, he did fine, didn't mind brushing teeth, but brushing his teeth, he would, do that bit. I'm like, no.
Oh my gosh. Yeah.
And they owe texture. So when he got older and they tried to do the fluoride, pasty stuff. I don't know what it's called, but and he's like, oh, that was just a nightmare. Because it just make I think the texture of it on his teeth just really bothered. He's gotten a whole lot better.
Oh, good, good.
Yeah,
poor thing. I do feel bad for my patients that are gaggers. Some offices carry like a numbing spray that we spray on the tongue, kind of decrease the reflex or not the reflex, the sensation of whatever is setting it off. Some patients, it's like a certain spot, like it might be their tongue, it might be their cheek. So I kind of have to like figure it out and avoid that area or work around it. And of course, they're the ones that always need treatment on the back tooth. And I'm like, why?
Oh,
So, and then another trick I found out later in my career is salt on the back of their tongue. And apparently this helps. I've tried it on a few patients and it decreases the sensation a little bit also. So we try all sorts of things, but gaggers are just, bless them. They'll have a hard time with the dentist.
They're special.
Yeah.
It's getting better there. It's getting better, but thankfully I'm very blessed that he doesn't like a lot of sweets. So we're good with no cavities, no nothing. I mean, he's always done really well, but yeah, he is like every time, Aaron, really like,
I know, they just can't help it. It's sad.
Yeah. I recently took him to see the dentist, and they were going to do sealant. And he's like, they're going to do what? What, Mom? I'm like, you're deep breath through your nose, breathe through your nose. Like, his mouth is going to be open a little bit longer. And that was last week.
Just let you know, it's stressful for us also.
Yeah.
We just try not to show it.
Yeah, I'm sure that's true. Emma had that sealant done sort of recently, but she liked it because she said it tastes like pickle. It was like, okay, kid, whatever works,
How old is she? How old is she?
She's 11.
Oh gosh. Kids are so fun. And this is why I'm like, pediatric dentists have the funnest times because they have the funniest patients and they just love things that kids say. Like some kids with the fluoride varnish you're talking about just love the taste, and others are like, oh, it tastes so gross. And I'm like, I don't know what you want. But that's so funny. I'll have to
Yeah.
look at that. That's funny.
So what does a typical workday look like for you? Are you seeing patients all day, or how does it work?
Yeah, so we open at 9 and close at 5. So
Okay.
we try and we can see patients as late as 4 o'clock, depending on what they need. If it's a new patient, we try and give an hour and a half block so we can really focus on you and everything you need. So usually those start around 3:30, and I try and get out there by 5, but it does not happen because I'm the owner. So there's always something at the end, and then I'm like rushing out the door to go pick up the kids and everything like that. But yeah, it's 9 to 5. Tuesday through Thursdays is when we see patients. And then Mondays and Fridays, we're not actively seeing patients because we're still kind of growing. So we haven't filled in the whole week yet. And then Fridays is 9 to 12.
Okay.
Yeah.
And what kinds of procedures are you? Is it just like preventative care? Do you guys do any cosmetic stuff at the office?
Yeah, I mean, we do everything. So, we do fillings, crowns, bridges. I restore implant crowns. I don't place the implant, but I have a specialist that does. I do extractions, taking teeth out, preventative care. As far as cosmetic, we do, veneers. I only use tooth-colored fillings. Um, and then there's this new treatment that I've implemented. It's called resin infiltration. So it's basically if you're born with like these, how some people have like really white or brown spots. So there's a way that we can remove that without drilling on anything. So it's just some stuff that we put on your teeth, leave it on there, rinse it off, dry, all the things we do. And then by the end of the session, it's either severe, drastically decreased, or it's gone. I did it on a patient and she like cried. I didn't know how much that meant to her, but I guess she was like, it's always bothered me. And I was like, okay, well, we can try it. And it worked. And she was like emotional. And I was like, oh, I did it. This is great. Yeah. And I didn't need to numb her or use a handpiece or anything like that. So, and of course, we do teeth whitening in office and take home. So I always have a special going on that if you see the ad and you mention it and you're a new patient, you get like a free whitening syringe with a customized bleaching tray that we make for you. But you have to see the ad. So not everyone knows about it. And they're like, I saw your ad on Facebook. And I'm like, okay, then you get,
there you go.
Yeah.
Awesome.
That's great. Well, that's a lot. I mean, being obviously you have young children and opening your practice. So can you share some of the challenges of having your own business and running your office and having small children? Can you
it's just chaos.
I guess you talk about like trying to leave on time, right? To go get them since you're the owner.
It's a different level of, it's like running two homes. It's exactly like running two homes. So, I get the groceries for home. I have to order the supplies for my office. So I always have to know what inventory is going on. Luckily, my staff helps with that. I have to manage my kids at home and I have to manage patients and staff at my office. And so it's very difficult because, as moms, we tend to take on a lot and try and do a lot. And so I have to teach myself to delegate more at the office, which I don't do as much at home. But, at the office, you try and do that. But yeah, it's tough, like I'm up early getting lunch for my kids. They're out the door. Then it's a matter of me getting ready, taking my youngest to daycare, rushing work. And then you do work, which dentistry is very physical. If you come see me, you'll see me stretching, by the way. Like I'm always sore and going like this. So it's very physical. And then, sometimes the day doesn't go smoothly. If you have a gagging patient, you're going to move slower. If you have a patient that has a dental phobia, you can't work as fast. Or they have a small mouth and, their saliva's all over the place. And so everything, is a little slower. Start thinking, oh God, I'm running late. And then you're thinking about how am I going to get the kids on time? And so it's a lot of to balance, and then you get home and you snap back, into mommy phase, dinner, homework, bedtime, and it's pretty exhausting because whenever you're an employee, you don't have to worry as much about, the things in the back end. But
That's
now
true.
I sometimes take that home with me because I have to. So I'm like working from home, and so it's a lot. It's a lot to balance and a lot to think of. And sometimes I'm like, I don't want to make any decisions. Can you just can someone
Yes,
run
I
the
agree.
office for me? Yeah.
Yeah. Even when you get home, sometimes it's like, I don't even like, I know we all have to eat and like we all have to have dinner. I don't want to cook. I don't even want to decide that stuff. If I haven't already
Right.
decided, if I haven't
I
taken
know.
something out to make for dinner, like either we're ordering or we're not eating because I don't know what we're
I
doing.
know. Y'all don't want to see how we eat in this house. Like it is not good. And like even the whole picturesque sit down dinner time, like that's not happening. My fourth grader is doing homework and eating, my middle kid is always doing something and eating.
Right.
Little
Yeah.
ones,
Our house is very much the same.
yeah, I'm just like, I want to sit down as a family and eat dinner, but it's just not happening. Sometimes my husband and I eat after the kids are in bed.
Yep.
It's just like, okay, what is chicken nuggets and mac and cheese? That's 30 minutes. Let's do that. Y'all eat bedtime. And then my husband and I are like, what are we eating?
Yeah.
A bowl of cereal.
Yeah.
Before you go to bed.
Yeah, I like a bowl of cereal. Or sometimes, by some miraculousness, I'm able to feed everyone. And then I don't eat. Like I'm just
Right.
busy doing stuff. So yeah, it's chaos. And adding the third kid like exponentially added chaos. I didn't know
Oh
how
my
great
gosh.
there would be.
I have 3 kids, and I always say like 3 is like having 30. I mean,
Yeah.
there's like for whatever reason, I don't know if it's like when they outnumber you and your spouse
I don't
or
know
what
what
it
it
is,
is.
but like that third kid, and in our house, that third kid is like a feral animal. Like she's so wild. I mean, I love her. She's the funniest and she is so awesome, but she is wild.
Yes.
And so it's like, I think that if she, like, this was like the universe or something, like working it out this way, because if she would have been the first one, that would have been it. No more.
Right.
One and done.
Yeah, that would have been it. So yeah, we got that one last, luckily, and that's how we have 3.
Well, to give you a little hope,
Yeah.
as they get older, they can do things a little bit more on their own.
Yes.
It doesn't get easier, it just gets more manageable.
Yeah. I think for us, it was just schedule. Like, when she's supposed to be going to bed, I'm still working on homework, or when she was younger, the older ones have energy to get out, but it's nap time. Like she gets 2, 3 naps. And then it was just schedule was just weird. And I'm just like, I don't know how to manage this. And, and, cause my kids are 9, 7, and then she's, 2. So it was like this 5-year difference.
Yeah.
So I wasn't used to that because the other ones were like 2 years apart. So a lot of the things was happening together at the same time or similar, but they're like in different phases now. And I was like, this is chaos. But I think the third kid is just no one's like raising them. They're just like, that's why they're just like all over.
Oh, that's funny.
I mean, because the first kid you're so focused on, and they're usually kind of a
Do
little
everything right.
yeah, and then the middle kid is just, I've heard they're quirky and weird, which mine kind of is. She's kind of quirky and just does her own thing.
Yes,
And
that's what
then
this child is too. She would be happy to just be left alone to do her own thing and
yeah.
not really be bothered by anyone. That would be like an ideal situation for her.
Well, my middle kid is very, and I don't know if it's getting worse. Like she is very clingy. Like she'll just hold on to, like, how they say moms are touched out by the end of the day.
Yeah.
And I'm just
Yes.
like,
Yes.
yes. And I didn't get that until recently. She's always like, want someone with her, but sometimes you're right. She's just by herself, and I'm like, where's Hannah? And she's just off doing something. And then the third one, I don't know how many times I've been like, hey, where's Leia? Like, I did not, where is she? She's off, playing with her sisters or, watching Coco Melon, which she's obsessed with.
Oh,
And
yeah.
so Yeah. It's fun though. It's like chaotic but fun at the same
Yeah.
time. Yeah. So
Well, so I have three, but they're much older. So I have a bonus child. My very first is my stepson, and he's 19 now. And then I have Tyler, who is 15, and then I have Aaron, who's 13 now. They're 18 months apart. So it was crazy, but I liked having the craziness together because they were in similar stages. Whereas my older one,
yeah.
there's a gap, right?
Yeah.
And it was it's a struggle to keep them all on the same page. But as they get older, you're just in different places because we're just an Uber to them. We just take them everywhere. And we're
Like,
trying to get to every game on time and whatever else is going on.
oh, that's the thing. Like, so my kids aren't in activities yet, which is another mom guilt because I'm like, I don't know where's the time. Like, I'm trying to rush out
Yeah.
of work at 5, and I'm like, where do I fit in activities? I don't understand how other moms do it, but
We don't either.
We don't either.
We did a whole episode about that already that we aired about kids and activities.
I was listening to that.
Yeah,
I think I was
and
in the
Marie and I
middle of
both were
it.
just like, how are these people doing this? Like, how are they
I
living
don't know.
their lives? It just seems so
Yeah,
chaotic to be working and doing all of those things.
Well,
right.
and
I
since
don't
you
know.
own your own business, like you said, it's two households that you're running. It's not
Yeah,
just one. And having that on top of having three, and let's say they all have three different interests. So that like
God
you're not
no.
all in the same sport or that I'm in the same arts and crafts or whatever it is, right?
Yes. I don't know how, because my middle one's been begging to do gymnastics, and I'm like, I don't know how to get you to gymnastics at 4:30 on a Thursday. Like, I don't know how that's gonna work, kid.
Yeah.
Yeah.
So it's kind of hard, and then you feel like guilty, like, wow, should I be exposing them to more and all this stuff? But they seem fine so far.
They'll make it fine.
Yeah.
We waited a little bit older. With the boys tried to do we did karate at an early age and we tried to stick with it, but the problem was they changed the time and I couldn't get there between picking them up from school when they started school to the practice because if I went to the later one, it was their bedtime. Like it was either too early or too late.
I don't
So
understand it.
we ended up hanging out and kind of waiting to get them really involved in kind of seeing what they wanted to do,
Mhm.
which is mainly sports right now. And it's still a struggle. Like my older one, he really is really into lacrosse, but the practice is from 5:30 to 7:30 in the evening. I'm like, if I go get you from school, by the time we get home and then we're home for 10 minutes, we have to go back. Like you won't have
Yeah.
enough time. So he has to hang out after school. And I said, that's when you have to study. You have to
Okay, that was my question. I was like, when does he
yeah,
do homework?
he
Okay.
does homework, so he has to be disciplined. I'm like, if your grades fall below this, you're out. Like you have to be,
Mm. Oh,
mature enough to sit. So he does. He'll go into the locker room and he'll study between 3:30 and 5:30. And if you're missing an assignment, done. Like we're not doing
I
this.
mean, that's fair. I like that.
Yeah.
I like that. I'll have to
It
read
just
that.
he doesn't get home till 7. Oh, he gets out at 7:30. By the time we get home, it's almost 8. So eating dinner is very late. So a lot of times I'm packing a double lunch so he can eat something,
Oh my
so he's not eating so late in the evening. It doesn't get better with age, but they are more manageable. They
God.
can do stuff on their own. Like
Okay.
it is, yeah. So
Just too
activities do
much.
come. It's always a challenge.
Uh,
Always.
there's just too much to think of as a mom. There's just too
Mhm.
much.
Yeah. Yeah, for
It is.
sure.
It definitely is.
We've talked about some of the struggles, but what is your favorite part about your job? We always like to ask our guests, and I always like to hear the answers.
Well, I mean, the best part of being the business owner is that I can set my own schedule a little bit more. So my
Mhm.
motivation for opening an office was, schedule. I got tired of asking off for my kids' birthdays or holidays, like Memorial Day. I remember there was one Memorial Day I was like leaving for work and my husband and kids are home and I'm like, this sucks. Like, that's an entire family day gone. So the best part is having control of that. And then the best part of dentistry is really educating my patients. I find a lot of people that have had previous dental work and they have no idea like what they had done, or they have like a chronic dental issue that no one explained to them why. And so I kind of love educating patients, and then they have this kind of aha moment where they're like, oh, so that's what's happening. And then they can kind of take ownership, and equip themselves with that knowledge. Like my website has a whole section called, so my office name is Primway Dental, and then I have a whole section called Primway University, where you can just click on a topic and I will explain it to you, so you can better understand what is going on in your mouth. Like I've had patients that are like, I've never had a root canal. I'm like, I'm looking at two on your x-ray. Like, how did you not know that?
Then no, then I mean, I guess people don't, when it's a topic that you don't understand, you're like, oh, okay. You just assume the doctor knows what they're doing and you go along with it.
Right. And so it's like they had this procedure and they didn't know they had it. And I'm like, we need to fix this. Like, you need to know what's going on in your body, just like you would for like a medical issue. Like you wouldn't have a medical surgery and be like, what did we do? Like you're going to know all the details, and because you want to know, and it's your health. So I love educating patients on that. And also like patients that have dental phobia, just trying to put them at ease. So like my office is kind of I designed it with moms in mind. Like you should come and sleep. Like that's kind of what I want. Like I have TVs on the ceiling. We have neck pillows if you want it, blankets. Because I wanted it a way that moms are like, oh, this is my time away from my kids.
Yeah, not a stressful time, but a relaxing time.
Great idea.
Yeah, and that's kind of how I designed it. Like you should feel relaxed. And so I also enjoy whenever I hear patients, like I'm working on them and they're laughing because they're watching a Netflix show. And I'm like, oh, they're totally comfortable. Like they forgot I'm here, So that is like the best part. And I'm like, yes, working, so they'll associate a positive experience with the dental office and be like, hey, that wasn't too bad. I'll be back. And so now then we have like a continuous care for your oral health. So that's the best part for me.
Well, do you see people that might have a dental phobia if they have it as, an adult? Sometimes it can, pass down to children and it's kind of a generational thing where it keeps going and going and going because they don't not see the importance of, but because of their phobia, they might not be doing the 6-month exams and cleanings and stuff like that on a regular basis.
Yeah. Oh, yeah. I see that all the time. A lot of my patients that are 60 and up have a dental phobia from something that happened in the office as a kid. Like they're like, my dentist was so mean when I was like 5 or 10, and they're just so traumatized by it. And so if they don't bring themselves in, they're not going to bring their kids in. Right. And so the kids talk, and, another kid friend might be like, oh, I went to the dentist's office and they pulled a tooth or they did this. And then kids start hearing stuff, but they haven't experienced it themselves because their parents are scared to bring them in. I've had, patients in the chair, and then the parents are like, you better behave, he's going to give you a shot. And I'm like, no. Like now you're associating something negative with the experience, but that's what they know. So yeah, I definitely see it. And so we're just trying to break that, Granted, the dental office is not somewhere where you're like, I just want to go there right now and chill, but I just don't want you to be terrified of it and then worse, pass it on to your kids. And then I have parents that are the opposite, that are afraid, but they don't want their kids' teeth to end up like theirs. Yeah. And so they bring their kids in religiously. And then I'm like, you need to come in, and be in my chair also. So I see both sides.
That was my mom. She didn't want us to have bad teeth. And she focused on us. There's 5 of us growing up. She focused on our teeth and didn't really take care of hers. And what they don't realize is that a lot of infections start as you get, and into your bloodstream. Your teeth are extremely important. Right. Yeah. And they don't realize that until sometimes it's too,
And it's crazy to say that. I hear that all the time. Like my female patients that are in their 40s, they're like, my kids are older now, or they're at the house and it's my time now. And it's kind of sad to me that, as moms, put ourselves last so much.
Yeah.
But I get it. I mean, I do it too. So, but I hear that a lot. Women coming in later on in life and they're like, okay, it's my time to get my teeth fixed. Women are usually the ones that are calling the office for kids and husbands.
Yeah.
And, and it's just, so yeah, I get that for sure.
I love it. I think people don't realize how much your smiles and how important it is in your self-confidence until they have time to really like, hey, I wish I would have done this 20 years ago. I wish I would have gotten
Right.
my gap filled or whatever the case is.
Yeah.
And again, as moms, we always put others first a lot of times and forget to take care of ourselves.
It's true. It's sad to me when a patient comes in and they're like, they don't smile or, they're embarrassed of their teeth, and everyone always thinks they have the worst teeth or mouth. And I'm like, you do not, but it really does affect their confidence. And, once you fix that front tooth that, they've just been hiding, they're smiling more and their whole demeanor changes. It's pretty remarkable to see.
Well, I had a friend of mine had said she was really, not really happy, but she was relieved, I guess is a good way to put it, when people wore masks, because she's very self-conscious about their teeth. And as people have gotten less mask wearing these days, right? She still wears one, not because she fears, she doesn't fear, getting sick as obviously helps with allergies, that she says. But I think it's also because she's very self-conscious about her teeth. And it's she's a mom. I'm like, yeah, you can take care of your teeth too. Like, go to,
Yeah, it's sad. It's sad. Yeah. But that's why we're here.
Yeah, definitely.
No, that's great. And so I guess, can you just let our listeners know how they can reach you if they want to, contact you for your services?
Yes. So you can go to my website, www.primwaydental.com. And right on the front page is a button that you can click that says reserve appointment. So you can actually schedule online anytime. And as you're scheduling, it'll let you know if we're in or out of network. So you don't need to worry about that. We see out of network patients also. And then we do the courtesy of, finding information for your insurance. And our phone number, also 210-688-9320, is on there. You can email us. You can text to that number also, and we'll get it. So there's all sorts of ways to find us. Yeah.
Oh, good. That's awesome. And we'll put some of that stuff in the episode
Definitely
also. And that way people can see all of that. But yeah, thank you so much for being a guest on here. This was so fun. And I learned
it was fun.
And it was nice to chat with a fellow working mom about mom stuff too.
It's nice. It's nice to know that I'm not the only one having these struggles. Because the dinner time thing, I was really like, I feel like I'm doing something wrong. So this actually is good to know it's not just me.
No, absolutely not. It is not just you.
Awesome.
It's everyone. And we all manage. And if it's pizza one night, it's okay.
Yeah.
If it's pizza 2 nights, it's okay.
Yeah.
Awesome. Well, thank you so much. This was a lot of fun.
Yeah.
Thank you. We appreciate you.
Yes. And thank you so much to our listeners for tuning into this episode of the Working Moms of San Antonio podcast. And we'll just catch you guys next week.
Thanks so much for tuning in to the Working Moms of San Antonio podcast. Be sure to follow us on social media at our respective Instagram accounts or join our Working Moms of San Antonio Facebook group. Those links can be found in our episode description. If you have an episode topic suggestion or question, please email us at office@radisagent.com. And be sure to subscribe to the podcast and leave us a review. See you next week.